And the recording is going. My name is Todd Kukan. I'm with the Portage County Business Council. I want to officially welcome you to this Portage County Town Hall this afternoon. We have quite a number of folks on the agenda, and we've all committed to speaking 2 to 3 minutes on our particular topic, but giving you an update on what's going on in Portage County. We have put everybody on mute, so if you do have questions, I just again posted the email address, countyexecutive@co.portage.wi.us. Please send your questions there. We had some sent in ahead of time that we'll address as well. I think with that, I'm just going to turn it over to Chris Homan. Chris is the Portage County Executive Director. Chris, appreciate your willingness to come on along with everybody else to share the word on what's going on in Portage County.
No, thanks, Todd, and thanks for hosting. It's really a great service to the community, and I think that tonight's conversation will hopefully be one of many to come. So with that being said, good evening to everybody. Thank you all for tuning in today. I'm glad you've taken the time to join the conversation. Thank you to all of our guests who have graciously volunteered their time for this first virtual town hall. As Todd said, my name is Chris Holman. I'm the Portage County Executive. And I'm happy that we're all here today because, my job focuses a lot on the administration of county operations and helping inform the policymaking process for the county board, but it also involves a great deal of communication and education. So I think that forums like this one can really help further educate the public on a variety of issues relating to our communities and the state's response to COVID-19. So hopefully today's conversation will do just that and help provide some clarification for people on issues that aren't often discussed in one place. In order to facilitate today's conversation, as Todd had mentioned, we did ask members of the public to send in their questions beforehand, and we will work through those questions first. And if time allows, or if it's appropriate for the question that we're dealing with, certainly be able to address other questions that come up as a part of the overall conversation. In addition to any that may be sent in during the town hall itself. Before we get to the questions and answers though, as Todd noted, the members of the panel will each take a few minutes to discuss who they are, what do they do, how are they confronting COVID-19 in their worlds, and what challenges have they run into. We have an excellent panel with us today, and if we end up not getting to every question that comes up, we will be sure to get answers to those questions and post those along with questions discussed tonight to the web for future reference. Of course, members of the public are always encouraged to reach out with any questions they have, so please continue to do that as well. Obviously, we will not be able to cover every facet of our collective response to COVID-19 today, but it's an incredible start. So it's my hope that we can move forward with more of these types of meetings from here on out so that we provide regular opportunities for a unique type of engagement with the public that's beyond the daily press releases we put out and information we send through other outlets. Thanks again for attending and watching today's town hall. And with that, let me introduce our moderator for today, Amy Eddy. Amy is a certified elder law attorney who works locally at the Anderson O'Brien Law Firm. And on behalf of all of us, I'd like to thank her for helping move the conversation along today. Amy?
Thank you, Chris, and thank you, Todd, for inviting me to be the moderator and for promoting me to co-host while we're waiting for everyone to come in. Before we get started with the presentations, I just want to make sure that we introduce everyone who's on the panel. If you can give a little wave when I say your name, then everybody can kind of see your faces before we go into the presentations. We have with us today Portage County Health and Human Services Director Ray Shavelski. There he is. Portage County Public Health Officer Gary Garski, Portage County Executive Chris Holman, who we just heard from, Portage County Sheriff Mike Lucas, Portage County Board Chair Al Haga, there's Al, Portage County Business Council Executive Director Todd Kukan, who welcomed us and who's off screen now, SBA Convention and Visitors Bureau Executive Director Sarah Brisch, where's Sarah? There she is. Data scientist and community leader John Omarnick, SBA Public School District Superintendent Craig Gerlock, UWSP Chancellor Bernie Patterson, Wisconsin Counties Association Representative Mark OConnell, and VP of Virus Stevens Point Clinic, Bob Smith. There's Bob. Okay, thank you everyone for being here. It's great to see so much engagement from the community, and I do see so many familiar faces as well. So thank you everyone for attending. We're gonna go ahead and start with a 2 to 3 minute presentation from some of our panel members so that they can give us an update on their organization's response to COVID-19. And we're gonna go ahead and start with Public Health Officer Gary Garski.
Good afternoon, everyone, and thank you for hosting this, by the way. Oops, I'm unmuted, yes? Okay. So I'm Gary Garski. I'm the Portage County Health Officer. I'm also the Public Health Manager here at the Division of Public Health within Portage County Health and Human Services. Public health's role in all of this really is addressing COVID-19 in our community as a pandemic, as a communicable disease, and providing communicable disease response. So that response basically is notification to us of all positive cases and negative cases, and for positive cases providing both contact tracing, interviewing, disease monitoring, and then isolation order, and then for identified close contacts, putting quarantine orders out as well. The purpose of this really is a mitigation plan. It's the only plan we currently have to fight the COVID-19 virus, because there currently is no known vaccination available to protect us as a population. So we use isolation and quarantine as a mitigation tool to help slow the spread of the virus in our community. And those are my updates.
Thank you. Next, we're going to hear from Sheriff Mike Lucas.
Hi, I guess I just tell you a little bit what the Sheriff's Office is doing here for the COVID response, along with assisting with the health department if they need some assistance for isolation or quarantine orders to be served. We have been proactive in regards to our 5 divisions here, especially for our jail. We do have, policies in regards to infectious diseases, but this has taken us a little bit differently. So we have local providers that have assisted us in regards to testing inmates when they come in, so that we are able to not quarantine somebody for 14 days. They can go into general population sooner. Same with our officers through any kind of symptoms. They're able to get testing quickly so that we can determine if they are positive and have to be in isolation or quarantine, along with other staff members. They are masked. We have EMS, emergency management. The dispatch center is also in what I call kind of a lockdown, that the only staff goes in there from the dispatch center, along with temperaturing before they enter in there, so that we don't have a spread, because these are essential for people out in the community. In case they need assistance, we need to have those people responding. So
thank you. Thank you, Sheriff Lucas. Next, we'll hear from WCA Representative Mark OConnell.
Thanks, Amy. My name is Mark OConnell. I'm the Executive Director of the Wisconsin Counties Association. I oversee the association, and the association assists counties at the state and federal level in trying to get done whatever it is counties wish to get done. But in addition, we provide education, guidance, assistance where appropriate. COVID-19 has been one of those areas where additional information and guidance has been very appropriate. I compliment Portage County and the Portage County business community and interested parties in having this sort of town hall, because if there is an upside to COVID, and I'm not sure that there is, but if there were to be an upside, we would say it has provided an opportunity for our elected officials, our leaders, and the public to have a productive conversation, which really, that is what this is. No one asked for COVID, and none of us wish it to be here. We all wish it to go away as quickly as possible, but we have to deal with what it is we have before us. At the association, we have provided guidance to counties on a whole host of areas, trying to assist counties in understanding or applying guidance that fits their local conditions, but also protects the public at the same time. I have often said, and this, as the saying goes, public health saved your life today, you just didn't know it. Well, with COVID, now we know it. And we don't necessarily like how it has gone, but we do know that public health has done a lot to save lives.
Thank you. Next, can we hear from Bob Smith from Aspira Stevens Point Clinic?
Yes, good afternoon, and thanks for having us on. Appreciate this engagement with everybody. Just a little background with Aspirus. Early on, we took a very aggressive approach to setting up an emergency operations center. And as many of you have seen and heard, early on, there was just a lot of unknown about this disease, and continues to be so. But we've learned a great deal, and we set up our emergency operations center so we could gather intel and information and operate as an organization in kind of a unified way to have a consistent approach to all the communities that we serve. We did quickly set up a hotline for the community to share information as we were gathering information. And like you heard many other healthcare organizations, it was about conserving PPE. We were quick about getting additional resources and purchasing PPE, and then preparing for the surge. Things that we saw on the coast where this was first hitting was a surge of patients, and how would we manage those patients if indeed that surge came? Were our facilities and our staff prepared to manage that? So we did a great deal in making sure and procuring supplies. We did some education of our staff, what we call upstaff, so they could learn how to take care of a more acute patient or patient specifically with COVID. So we've also done the test sites, trying to control the environment of where COVID or suspected COVID patients might go. So we've got outside tents where people can discreetly pull up and have the test done and have those results given to you very quickly. So we set that up. We do a great deal in screening our staff as well, trying again to create this environment of safety so patients can continue to seek healthcare in our facilities. Early on, we did a lot in shutting down elective procedures, just again, so we could control things and have a better feel of what we were dealing with and be prepared to handle what we were anticipating if the trends would have continued and had we not flattened that curve. That's what we were working on. And then most recently, we're looking now more aggressively on that testing capability. We've got some new approaches that we're looking to look at set up in our labs. We're looking to have a piece of equipment specific here in Stevens Point for Portage County, so we can turn around those results that much quicker. So we're hoping to have that this fall. We're also looking at infrared imaging scanning capabilities. We'll have that by October as well. So people coming and going, we can ensure are free of symptoms so we can manage those appropriately and safely. So those are some of the things we're working on here right now. More to come, I'm sure.
Thank you, Bob. Next, can we hear from Craig Gerlock, our Stevens Point Public School District Superintendent?
Craig, can you click on unmute, because I'm having trouble unmuting you. Try it one more time. I've tried a couple different things. Maybe we might have to come back to Craig.
Yeah, let's come back to Craig. Let's go to, until Craig's unmuted, can we hear from Bernie Patterson? Are you able to unmute from UWSP?
Bernie's set, yep.
I think I am unmuted. Can you hear me?
Yep.
Perfect.
Amy, thank you. Thank you. The health and safety of our faculty, staff, and students, as well as our communities, has been and will continue to be our priorities. Since late January, UW-Stevens Point has monitored the coronavirus, and in February, we activated our Emergency Operations Center. Following spring break in March, we moved all our courses online, and students in the residence halls moved back home with some exceptions. In late March, employees who could work from home were required to do so. Events and activities were canceled on campus, and all of this was done to reduce the risk of COVID-19. We are gradually returning to campus. We will offer a mixture of in-person, online, and hybrid courses this fall. We have rearranged our classrooms, our laboratories, our studios, and our meeting spaces using a bubble diagram with a radius of 4.5 feet. This has reduced the capacity in our classrooms and is the most conservative measure of any school in the UW system. It's reducing our classroom capacity by 70 to 80%, which is one of the reasons several classes had to move online for the lack of classroom space now. Other campuses have reduced their classroom space by only 50%. Faculty have prepared their courses to be taught in person and online at the same time. This has been a huge lift for our faculty. but we're prepared to go online if necessary. We are requiring daily symptom screening by employees and students before coming to any of our UW-Stevens Point locations. We encourage social distancing and working remotely when possible. We have increased cleaning and disinfecting and have provided departments with cleaning kits and sneeze shields in key service areas. We're providing face coverings and refillable hand sanitizer bottles to students and employees. We're encouraging frequent and thorough hand washing. We are requiring COVID-19 training for all employees and students. We communicate at least weekly with employees and students. My last message to campus about COVID-19 was number 44. We have a dedicated web page for COVID information and resources and a COVID-19 hotline. And we have had now 4 town hall meetings on campus. We are launching a Why I Wear a Mask series featuring students and faculty on social media. And we have established procedures for testing, quarantine, and isolation of students if they test positive. And I've saved for last what I believe the most important. We are requiring face coverings and masks for everyone on campus, and we strongly support this in our communities. Why? It's simple, because it will save lives. Masking cannot become a red or a blue issue. We cannot allow this to become a political issue. We must work together as a community as we unite to defeat this invisible enemy and to protect everyone in our community. Thank you.
Thank you, Bernie. I think that Craig is still muted. Are you on? Have you been able to unmute?
Let me.
I don't know what happened there.
Yeah, you're
Oh,
good.
there he is. Very
Can you
good.
hear me?
We have him.
I'm sorry. I don't know what happened there. This is my 10th such meeting this week. And as a school district, our team can talk on this for hours and hours. So I'm going to talk very fast here to keep this in with 2-3 minutes. And if I go over somebody, just Todd cut me off. Amy cut me. We've been dealing with this since March. We actually canceled school prior to the governor shutting the state down because of the timing of our spring break. At that particular point in time, we had no idea what this would lead to. We started back in March planning for reopening of schools. The first thing we did was created a district forum, if I may, and we've invited representatives from obviously Health and Human Services, Ray and Gary, the university, Mid-State, nonprofits, Todd Kukan, legislators, local governments, and we've had an opportunity each week to have these conversations to share ideas and updates and whatnot. We've been meeting about every other week now. We've learned a lot from one another. Governor Evers has authorized local control in terms of the decision-making process here. Therefore, we put together a plan that our board approved in June, which involves several phases from complete return person to person to blended, and then of course virtual. They also authorized myself to make the decisions as we begin school, and then make further decisions moving through the status of COVID. I've been working very closely with Gary Garski, Ray Shabilsky, in terms of guidance, also using guidance from the CDC, DPI, WIAA, and of course my own state association as we move forward. We disclosed our plan 2 weeks ago. I've had several meetings this week talking with families and teachers to explain in detail the plan. We are going, if you probably know this, but we are going in person pre-K through 6, Monday, Tuesday, Thursday, Friday. Wednesday is going to be a day of prep for teachers. We're going to expect our teachers to plan for online learning as well as face-to-face. So it's going to be a stretch, and we simply need more time to do that. It'll also allow us a day of deep cleaning in the facilities. Secondary will be a blended model. To begin the school year, we'll have 2 cohorts, A and B. Half the students basically will come Monday and Tuesday, the other half Thursday and Friday. Wednesday, again, will be a day of deep clean and teacher preparation. We also are requiring masks. We made the decision to require masks, I should say face coverings. prior to the governor's order. We simply made a decision administratively. If we stand a chance of getting kids back into school, we have to require face coverings. Unfortunately, the governor's order does not include, it's simply masks. And we have several face coverings, including shields, that would work wonderfully for us in our classroom. So there's a little bit of frustration there.
Different things there, Paul.
We're going to bus children. We're going to reduce significantly. We increased bus routes to put 24 students per bus. We are anticipating a struggle as it relates to substitute bus drivers and quite frankly, substitute teachers. We are going to gradually begin school. School starts September 1st. We're starting September 8th. We want to gradually get our students back. We also need our teachers to have more time to prep for both e-learning and for face-to-face. Currently, we have about 10% of our students or parents that are choosing for their students to go virtual. I expect that. I think people are waiting to learn more. I expect that to get it closer to 15%. Quite frankly, I'd be happy if it got to 20, 25% because it will assist us with the social distancing aspect in our rooms. We'll be going into, we had a very successful summer school. It was 3 weeks face-to-face. Now, granted, it was fewer kids, but we had an opportunity to go through our checklist of what we had to do in each room, much of what Bernie had already talked about. We will be emptying a lot of our classrooms. We're going to have to get rid of file cabinets and books and not book shelving so we can space our students. I firmly believe we need to get children back into school. We learn best when we're in front of teachers. It's extremely difficult to teach a second grader how to read when we're virtually teaching virtually. That said, we will only move forward in the safest environment. And if things change, we'll have to pivot. And what's going to happen on the 8th, I don't know. I do know that if we don't plan to go back to school, we aren't going to be ready for when we go back to school. I'm going to climb this hill and keep fighting until somebody says, Craig, you can't do this. We don't support that. And right now I have the support of the Portage County Health and Human Services, Gary in terms of public health. And we're going to continue to work hard to, quite frankly, get our kids back in school, knowing that not all kids will and not all of our teachers will. We have about 25 staff members that can't return due to health conditions. And we obviously will make accommodations for all of those students. If we don't get back to school in September, I don't know, it's going to be more difficult in October, November, January. And I think we run the risk of being out all year. And quite frankly, our children are going to suffer.
Thank you, Craig. I know that was a little bit longer presentation, but I also know that back to school is on a lot of people's minds in the community right now. So thank you for that.
I actually had my stop clock, but it went out on me.
Todd Kukan, you're next on the list. Can you give us updates as to what your organization has been up to?
Absolutely. Well, first of all, let me tell you, behind the scenes, it's been really exciting trying to run this meeting with getting people muted, unmuted. So apologies for that glitch in there, Craig. That was probably on our end. And for those of you specifically related to the school district, a lot of the meetings that Craig talked about are recorded on the school district website if you want to go get into a lot more detail about the schools. In terms of our business, we opened up as soon as we could, and I believe it was May 26th. We've done all the deep cleaning. We've practiced all the different CDC guidelines and all that. And that's what we've been telling our businesses to do since March is follow CDC guidelines, follow WEDC.org. There's a lot of guidelines in there that are specific to different businesses as well. So we've been following those, and that's what we've been promoting. That's what we've been doing at our events, and really been concerned about that, but trying to get as much back to normal as we can. A few of the questions that were submitted for the town hall: what precautions are businesses taking during this time? Again, it depends on the business how that works, but as I go into businesses and as I talk to businesses, they're doing a great job in terms of masks, in terms of social distancing, hand sanitizers, a lot of those different things. We're seeing that obviously, as Craig talked about the schools. Bernie with UWSP and all the different programs that are going on there in the community. Another question was about standardized guidance. Yes, again, go to wedc.org. I think there's 15 or so different plans there. You can obviously go to the CDC. Not that Gary needs and Ray need a lot more work to do, but they've been great in the community. Everybody has spoken very highly of them and their work, and a lot of communities and counties are jealous of how we've all been working together. Craig, I think, and Gary are almost like brothers now, as much time as they spent together, and many other businesses as well. So yes, there is standardized guidance. A question about punitive measures. As the governor put out his order number 1, there are punitive measures in there, and but we're hoping that businesses are being smart and using common sense. We're really a community in central Wisconsin of trust, and I think that's where we need to work from. And we don't know, if we're in a store, we don't know why somebody does or doesn't have a mask on, and it's probably not any of our business, but we do want to make sure that people are following those guidelines that are put down by the state. And maybe somebody from the county can talk a little bit more about that website. So there are punitive measures, but let's hope that we don't have to rely on those to run our county, that we can rely on common sense and trust. A question about why can't we know what businesses have been impacted by a positive case? There's been a lot of discussion about that in the state. There's been a lot of discussion about that, I know, in the county. I think there's some sensitivity to that, because just because there's a positive case at a business, that doesn't mean it was the business's lack of responsibility for doing that. A business may very well follow all the rules. Someone else may bring something into that business. So there has to be some care and discretion about how we share the information about businesses, in much the same vein that with individuals. That's not broadcasted as well. The county and the staff does a great job of contact tracing to help let people know that they may have been impacted by the disease. So I think that's our best route. And I know, again, Gary and Ray in the county have been doing a great job with that. The last piece, what is public health doing if business doesn't comply? I guess I can't, with contact tracing and cleaning efforts, I think most businesses are doing a pretty darn good job of complying. And if that isn't the case, then they have to the county will have to take matters into their hands in terms of what might be done to that business. But again, I think if common sense and trust can rule, I think we'll be in great shape. Follow the CDC guidelines, follow what Portage County is telling us, and we can be a lot better off and get more businesses open, get our students back at UWSP and in the school system, and help I see a lot of nonprofits on the phone that have been chipping in as well, helping the community, helping people who are struggling. So I think that's what's great about Portage County in central Wisconsin.
Thank you, Todd. So we have 2 more presentations to hear before we get to the questions. Can we hear from Sarah Brisch?
Sure. Hello, everyone. Undoubtedly, our industry has probably been one of the hardest hit due to this pandemic. Locally, we've had about 78 large-scale meetings, conventions, golf outings, and sports tournaments canceled. And so I would describe the work that our organization is doing best by the acronym ACE. A for the advocacy that we've been doing on behalf of the industry. We've been working with local, state, and national officials to support changes in ordinances and legislation, whether that be changes to PPP at a national level, or working with the city to grant dollars to small businesses that need the money the most, or extend outdoor seating for businesses so that they can offer a safe and responsible dining experience for our residents. So a lot of advocacy has been what we've been spending a lot of time doing. The C in the word A, or acronym ACE, would stand for communication. So we've been communicating through our COVID-19 resource page on our website, stevenspointarea.com, and through our public relations and social media efforts, how visitors and locals alike can navigate our community safely and responsibly. We know about 54% of the public really does want to travel and get out, but they want to do so in a safe and respectful manner. So our job has really been working, curating information from our partners in tourism, and publishing that information so that folks are aware of, again, how they can travel safely throughout the region. And lastly, the E for education. We've been spending an enormous amount of time educating our partners in tourism on the latest trends and best practices and offering them additional resources. I know when the pandemic first broke here in Wisconsin, it was everything from, letting folks know where they could get PPP, financial assistance, letting them know where they could get hand sanitizer, giving them guidelines for best practices that they could install in their businesses. So at the end of the day, our work is vital, and it's very imperative that we advocate for the industry and communicate to our partners and educate ourselves for the betterment really of the community. Small businesses are the backbone to our tourism product. It's important that we support these businesses. They're hanging on by mere threads, and we're doing whatever we can to support them. So that's what we've been up to.
Thank you, Sarah, for your updates and all your efforts. Finally, let's hear from John Omarnick, data scientist and community leader.
Thank you. Hello, my name is John Omarnick, and unlike all the previously introduced individuals who have aspired to, and by all accounts deserve the position that gives them a voice on this panel, I stumbled into my position. Together with my wife, Beth, we started the Central Wisconsin Massacres Facebook group at the end of June because, like many people, we were looking for a way to navigate the health challenges, economic uncertainty, and lack of connection to our local community during this COVID-19 pandemic. Our goal was simple: to leverage accurate data, provide a way for those who had concerns about COVID-19 to know which businesses were taking simple, common sense steps to protect the health of their employees, their patrons, and the community as a whole by wearing masks. Like many leaders during the COVID-19 pandemic, we didn't have a roadmap on how to approach these new problems. Unlike many leaders, we didn't have a platform or a voice in which to enact change, so we created one. When we started, we commented that it would be great if we had 400 people in our group. We never imagined that we'd be here representing close to 4,000 with over 500 businesses listed on our map. What we've learned from administering this, we've learned a lot from administering this group, including, despite what many would have us believe, this is not a political issue. We have Republicans and Democrats in our group. We have people who are politically active and those who are not. All of them care about healthy practices and care about local businesses in their community. We've learned business owners are scared. I've had many conversations with business owners and employees worried that a group like the Central Wisconsin Massacres could devolve and put already struggling businesses in a negative light. This is why our group focused on giving a voice to businesses, focused on the positive practices, and focused on constructive conversation around pandemic topics. We had so many business owners engage with members, asking questions and finding new ways to solve problems that were posed by COVID-19. High-risk individuals are also scared. I was overwhelmed by the number of people who reached out to me to say they went out for the first time since March and spent money at local business due to finding our group. This confirmed a suspicion I had, that when people were uncertain about safety practices, they stayed home, hurting our local economy. Prior to the statewide mandate, businesses felt forced to make a visible, politically charged choice that risked alienating a portion of their customer base no matter what choice they made. Even those business owners that personally supported wearing a mask felt that due to the uncertainty and volatility of this issue, that they couldn't require masks for fear of losing the income they needed to survive. So what does that mean for us after a statewide mandate is passed? Well, due to the confusion in enforcement and responsibilities related to the mandate, as well as the vocal portion of the population resisting the mandate, the group has asked us to continue to find objective ways in advocating to businesses, community leaders, and the public the importance of masks during the pandemic. Currently, that objective measure is the presence of a posted mask policy. We encourage businesses to post their mask policy and show your support for the health of the community while giving assurance to your customers that it is indeed safe to patronize your business. Thank you for having me on this panel today, and I'm looking forward to continuing to learn how we can evolve our community's collective COVID-19 response.
Thank you very much, John, and thank you to all of the panel members for your presentations. We're going to go ahead and get to the questions. There were a lot of questions submitted, and we don't have a lot of time, so I want to make sure that we can get a lot of these questions asked. I want to start with some questions on tracing, so this probably would go to Gary or Ray to talk about contact tracing. There were a couple of questions about that. The first one was, how long does it take for a contact tracer to notify an individual of possible interaction with a positive person? And then the second question said, having been on the periphery of individual infections, I've never been contacted by anyone having to do with my contact with the infected party and had to take my own actions once I discovered the individual was infected. Can you explain why I was never contacted by the contact tracers? So I think just an explanation of contact tracing in itself would answer both of those questions.
I'm sure it would, Amy, and thanks for asking the question. And I will certainly hand this off to Gary as well. But you know, our contact tracers, we're going to deal with contacting the positive case, assuring that that positive individual is in isolation, and making sure that they understand everything that is associated with being in isolation. Then, we're going to work with that individual to identify who those close contacts were in the case. And again, close contacts, that definition has changed throughout the pandemic, but certainly, if you had that physical contact, if you were within 6 feet for a period of time, you established and all those things. So, but really, it's through the positive individual that we're going to get those close contacts, and then we're going to be able to reach out and have a conversation with those close contacts and make them understand what being in quarantine means, that they were identified as a close contact. This all happens, one right after another. So is there a specific amount of time? Like we say, oh, it's going to be within 6 minutes after we receive the positive case. It really depends a lot upon, how many positive cases we're dealing with today and how many contact tracers we have on board. But again, and kind of to answer the second part of that question, you have to be identified as a close contact in order for a contact tracer to have contact with you.
Yep, and I'll just add to that fact. So COVID-19 is what we call a Category 1 communicable disease, and so we have a responsibility of response within a 24-hour window. And so typically, we get notified of all results, negative and positive, throughout the state through the different laboratories and doctors who test. And we will generally wait, once a response is posted, to make sure that the patient has been notified of the results before we reach out to them. But again, we only have a 24-hour window time frame to respond to all positive cases. For those that Ray mentioned, the close contacts, that typically is a 48-hour window at most to be contacted.
And as a follow-up to that, Gary or Ray, can you define what is a close contact that would mean that person is contacted? What does that mean to be a close contact?
Sure. So I can. So there are 4 categories defined by CDC that identifies a person as a close contact. First most is if you're a direct household contact, meaning that you live in a household with the individual, or perhaps, and we've seen this a lot this summer, you spent the night with an individual who was positive, like you were visiting overnight. Secondly, it's the time frame of 15 minutes of contact, 6 feet or less, with or without a mask. This is generally the one criteria that captures most people, because again, people say, well, I was wearing a mask. The mask does provide you protection, and there are studies that show if you were masked and they were masked, there's a good probability you won't capture or you won't catch the disease. But still, through CDC, it's still viewed as a close contact situation. Secondly, the other criteria is, was there a personal touch? So, for example, was there hugging? Was there shaking of hands? In high contact sports, those kind of physical actions occur that you would have had close contact to a positive case. And then finally, was there items that were shared? So in households, again, we see things like sharing of toothbrushes, having a common drinking cup, or even something sometimes is sharing a meal, like splitting a meal can be counted as a shared activity that would then condone you or identify you as a close contact to a positive case.
And I think the only thing I want to reiterate to that, Amy, is that these are the guidelines we get from CDC. These are not guidelines we make up. These
Correct.
are guidelines that we implement from the CDC.
Great, thank you for that. I want to switch gears a little bit. There are a lot of questions on the mask mandate, probably primarily on the mask mandate. And maybe Sheriff Lucas, you can address a couple of these questions. One of the questions says, it's my understanding that the Sheriff's Office will take no action on the mask mandate. What about disputes related to it? Does this mean that a business owner that is trying to enforce the mandate and possibly a non-regulatory policy when the mandate created by the emergency order expires, that business can't rely on the sheriff's department to remove someone who's refusing to wear a mask. And then a follow-up, what if the business owner is threatened, assaulted, battered? There's an assumption that the sheriff's office would respond to that, that the police department would respond to that.
Yeah, just a little, can you hear me?
Mm-hmm.
Okay, just a little purview. The Department of Justice came out a ruling right away when Emergency Order 1 came out that this wasn't a law enforcement function. It was a health department and the district attorney. My stances have been all along that, I have 3 staff out there during the day trying to take complaints and keep everybody safe. And in regards to our dispatch center, we take 176,000 calls a year. And I wanted to put that out right away, not to call 911 to our dispatch center, because there's so many exemptions to Emergency Order 1 that it's not our purview to come up to somebody and ask them why they're not wearing the mask. In regards to disturbances, of course, we're going to respond. It says right in the press release that I sent out that anytime there is a disturbance or somebody's not willing to leave, we would be called and we would ask them off the premises. We would cite in regards to disorderly or assault or anything like that, but we would not be citing for a mask violation.
Great, thank you for that. Related to the mask mandate, there's a question about the criteria once the mandate expires. So the question says, if a flexible mandate or wait and see policy is put in place after the state order expires, what are the data or the metrics that are being considered for triggering perhaps a county mandate or another type of mandate? Is it gross infection numbers, rate of rise in infections, overall rates, hospitalizations, fatalities? What are those data that would be considered in mandating something on the county level? Yeah, Chris. I think Chris is muted. Hold on.
Yeah, no, I can speak to pieces of that. I think one of the big questions in terms of the current order is what happens after the 60 days, like the question says. And there's, I think one of the questions is, does then a new order come after that? And we're not really sure what that looks like. I think that's one of the legal questions that's involved with how the governors use Chapter 323 this way. Now, in terms of county orders, I'll say, real big picture, you started to see a lot of mandates coming out at the municipal level. Lots of cities and villages were issuing mask mandates. And a lot of that has to do with what's called constitutional home rule, which gives municipalities a unique power to kind of take care of their own business in a way. And the language about home rule also includes that the legislature cannot preempt them. Whereas counties, as an arm of the state, we get preempted by the legislature quite a bit. We do a lot of work on behalf of the state. But the big question for every county has been, first, where are the lines of authority drawn? Because the chapter in state statute that discusses this for local health officer authority and such issues is very broad. It has, you could think of it as a large umbrella that, at first reading would say, well, it covers all the things you might want it to cover. But the thing is that without specificity underneath the statute, you get to the point where it also covers any potential challenge. And so because there's some ambiguity, there's terms in a statute that are undefined. And so you have to do some sort of extrapolation through statutory reference in other areas to figure out what exactly did they mean when they said this word in that paragraph. Those sorts of things are taking place. Those questions are being looked at through the Wisconsin Counties Association and others who are bringing stakeholders together to figure out what does that legal analysis look like. So that's been ongoing work. I can also tell you that many counties in the state, because this sort of issue doesn't typically land in counties' laps, right? So counties have had to say, all right, how do we now take what's in our code of ordinances and adapt to this? And in many cases, counties don't even have ordinances that address communicable diseases in a way that provides sort of a specific path forward. And so those are the questions that we're looking at answering on the kind of legal side. There's also on the public health side, I'm speaking for Ray and Gary a little bit here, but, in terms of criteria, I think a lot of the state statute hinges on local conditions. Now, how that can be interpreted is maybe up to each local jurisdiction. But I do know that, prior to this mandate, and even back in the spring, before things really started to take off, a lot of counties were issuing sort of gating criteria, different phases. So there could be like an ebb and flow of what's the status in any given county as it relates to COVID-19, as it relates to hospitalizations, things like that. And I agree with the question in the sense that there's certain factors of data that are lagging factors and that they're not going to show up until after certain other things have happened. But I can just summarize it by saying that I know that public health is scrutinizing the data locally quite a bit. They're not alone. DHS does the same thing. We have a tremendous amount of communication between our peers in other counties. And so I don't know that there's a specific answer for what would necessarily trigger something if there was something to trigger, but these are the sorts of questions that counties are working a lot on. And there's a degree of frustration with that in many communities. That's understandable, but I think part of it is the nature of bureaucracy and government and sort of a slow churn on some of these things, but also a lot of the uncertainties and trying to figure some of these, get answers to some of these big questions.
And as a follow-up to that, Chris, or maybe Gary or Ray or even John, data-wise, can you talk a little bit about those lagging indicators? There's a question that asks about, first of all, what is the county seeing in terms of compliance with the mandate? So is there any tracking of that? Do we know what the compliance rate is? And has there been any noticeable trend in cases in the county since the mandate order was issued?
So I can speak to that a little bit. So again, we recently have launched a masking concern form on our website, which again is kind of giving us indication of some of the concerns out in the community regarding the masking mandate. I will tell you, it's basically too soon to tell. We do a daily monitoring Monday through Friday of our local conditions, including positive cases, like new positive cases from the day before, new negative cases, fatalities, which we've been very fortunate that we have not had any fatalities here yet in Portage County, as well as looking at the percent of positive, which are the percent of active cases for our overall case count, and then are also our percent of recovery cases. This is then viewed in terms of both regional data that's available through our NCW HERC, as well as what data is put out by DHS dashboard. In particular, looking at it from the COVID-19 activity dashboard that comes out every Wednesday at 2 p.m. So that really truly is a gauge of indicating the amount or the factors that would indicate we still have community spread occurring in our community. And again, that comes out every Wednesday. It's posted in our situation reports Monday through Friday. It's also made available on our dashboard as a link on the county website as well.
So I think another component here too is to recognize that there were a lot of businesses, and whether at the local level or at the corporate level, are already putting in mask requirements prior to the mandate. So looking at the mandate and trying to identify a clear-cut effect the mandate has had in Portage County. I mean, right now I just checked our data. We have 268 businesses just in Portage County that are listed on the map, and most of those businesses were listed prior to the mandate. So, trying to identify a clear-cut, the mandate has caused this effect to change might be a little bit more difficult because of all the different conflating data that occurs.
Thank you. I would like to get in a few questions about school-related issues, and perhaps we can hear from Craig again on that. One of the questions says, I applaud the schools for having in-person classes. However, the upper grades being separated arbitrarily by last name is problematic. What's being considered to remedy the issues that students will have who are isolated from their only friends due to different last name groups? So maybe that has to do with how do you arrive at alphabetically?
It's the only way we can do it. We've got 1,500 students at SPASH, and trust me when I say we're contacted by many people that think they have solutions. That it just doesn't work. We need to get kids back in school, and we need to simplify it, or it's never going to happen.
And then can
the twist to that, and I get all that. If we're not successful with this, they're not with their friends anyway.
Right.
Because they're at home.
Can you or Bernie even speak to COVID testing resources that would be available as school related? Are there subsidies or things that can provide like the drive-through testing to be done for schools that's local and permanent? Is there anything like that in the works?
Bernie might be in a different position, but to my knowledge, if there was, we don't have the ability to require anyone to get tested. But the answer to that right now is no, we don't have a plan for testing students and or staff. I don't think we'd have the capacity right now, even if we wanted to. But again, to my knowledge, we don't have any authority as a school district to require. If a staff member gets infected with COVID, we'll work with Portage County through the tracing system, and they will be, whether it's a student and or a staff member, they'll be quarantined for 14 days.
At the university, we will be testing all symptomatic students. And for symptomatic employees, we'll be referring them to their private healthcare providers. We're also considering asymptomatic testing in the residence halls. That has not been completely worked out, and there's actually a difference of opinion about whether that is advisable or not. If we go down that path, then we will be hiring some additional staff to help administer those tests, because we'd have to test every student in the residence hall every 2 weeks. We would have to run about 330 tests every day, 5 days a week. So just the logistics of that is pretty daunting. The state has provided some additional funding in that regard, and that's all being sorted out as we speak.
Thank you.
Amy, I'd like to interject here too, and we're kind of planning for this as well. So we've had these conversations with some of the schools and communities that we serve about their resources. So like I said, we're trying to get a unit here in Stevens Point at our facility, our lab facility, to be able to do that. But to Bernie's comments, it's resource intensive to get it done. We do about 400 tests a week here, and it takes several staff to make that happen. And I see Gary shaking his head. He knows some of the things that we've got to do to fulfill that process. The other thing that we're really concerned about, and we're looking for solutions, is the medium and the test kits. That's the constraining part of all of this for all of us. And I'm sure that's part of the things that Bernie's alluding to, working through as well at the state level, is there's a finite number of tests out there that we can run. So we've got to solve for that and come up with some other creative ways to manage the stock, if you will, of that supply.
Yep, and to that end, so again, we here at Public Health, along with our NCW HERC partners, have developed regional testing plans. And here in Portage County, we are in a collaboration with all three of our medical systems, Marshfield Clinic, Aspirus, and Ascension, with Wood and Marathon counties, to develop, we have testing coordinators that we have developed and identified, and working on a plan that would serve all three of our counties. And again, as Bob alluded to, right now the situation is such that we're trying to address the fact that there are shortages in reagents for testing and available test kits. To that end, we received good news last week in that throughout the summer and throughout early spring, Wisconsin was very fortunate to have the National Guard available for us for testing. Here at our agency, Health and Human Services, we actually provided 4 community testing site days, and we're very successful at the testing that we did. And we just got word last Friday that mission for the National Guard has been extended now to the end of the year, but unfortunately has been reduced from 28 troops down to 11. And so it still serves as a resource for us in our testing plan, but our testing plan will now be working with that as a limited resource, and looking to see how we can fulfill other testing needs, especially with school reopening.
Thank you. So our time is growing short. I want to have one more question on kind of the other side of things before we wrap up. It has to do with the opinion that shutting down things like the pool, Gerlock Stadium, in light of having a relatively number of low cases as compared to other places, is there anything in progress to reconsider that? Are there any initiatives out there? Is that being looked at all on the county level?
So again, I can address that, and Ray can chime in as well. So we are in constant communication with many community partners, including the city of Stevens Point and their park director. They are currently operating on our order number 1, which was based on recommendations for mass gathering of not 50 or more. And again, at the time that was written, and it's true today, it was one of our tools, again, to help mitigate or slow the spread of the disease here in our community. Again, it's a recommendation. We understand that, this is a very fluid situation. Things will change, and hopefully now, following the masking mandate, especially if we see continued reduction in the number of positive cases, not only here in Portage County, but throughout the state, and especially around our surrounding communities, that we can revisit that again.
Great, thank you. Todd, there were a lot of questions that have gone unanswered. Is there a recommended place for people to continue asking their questions as we wrap up today?
I would suggest send it to that same email address, countyexecutive@co.portage.wi.us. County executive, all one word, at co.portage.wi.us. And then we can get those questions out to who's ever appropriate to answer those best if one of us can't answer them.
Wonderful, thank you. So that concludes our question and answer session so that we can wrap up on time. I'll turn it back over to Chris if you have any parting words.
Yeah, sure. Thank you. And thanks again for everybody for attending, for the panel. Thank you for your time. Obviously, we didn't get to every question, but what we'll do is we'll get the answers to the questions that went unanswered, and we will post those answers so that anybody can see what the question was and what the answer was. Just maybe it was a question that came up as you were sitting here tonight. But in any case, we'll make sure that that's available along with the town hall in general as a resource. And as I noted in my opening remarks, I do hope that we can do more of these in the future. So please stay tuned for those opportunities to learn more and to communicate with folks like who are on our panel today. We really appreciate the time that people took out of their day to be here. So thank you as well to those who sent in the questions for the panel. As a reminder, and kind of in addition to everything else, you can find the latest COVID-19 information, daily press releases and updates, and much more on the Portage County website, which is at co.portage.wi.us. And at the top of the page is a banner that will take you to the COVID-19 page, but also keep an eye on the In the Spotlight section towards the bottom, as we always put big news and information out there as it comes out. As we already noted, if you have further questions, please send them to the email. We'll give you or give us a call, and we'll get back to you as soon as we can. So thank you again. Please remember to wear your masks, be safe, and follow all the CDC, DHS, and local health department guidance. We're really in the midst of a serious sort of generational challenge here, and getting through it together is where we need to be, and that won't be a small feat. So thank you again, and I hope you all have a good evening.
Videos of these meetings are available for viewing on the city's website, stevenspoint.com/videos.